former FDA Associate Commissioner, President of the Center for Medicine in the Public Interest. Peter, it's good to see you. So these PBMs, they've been criticized for charging high fees and steering consumers toward mail-order pharmacies. Break down what the FTC is taking issue with here.
Well, it's about time that the FTC had a look at PBMs. The healthcare chutzpah of this industry is astounding. The last year before the pandemic, the PBMs made, you ready for this, about $40 billion in profits. $15 out of every $100 that consumers spend on prescription drugs go to PBMs. And of course, the PBMs, as premiums go up, blame the pharmaceutical industry. But again, if spending on pharmaceuticals was up about 38%, premiums and copays were up 102%. So where's that money going? It's not going back into the pocket of consumers. It's going into the coffers of PBMs, and that's exactly what the FTC wants to talk about.
Right. So these PBMs kind of considered the middlemen in the healthcare process, certainly when it comes to getting an actual prescription. But how influential, Peter, are they on the overall system in setting these prices?
Oh, it's a powerful lobby, and they're not really so much middlemen as they are gangsters. Because what they can say to a pharmaceutical company is, if you don't give us a discount of 40, 50, sometimes 60 or more percent, we're not going to tier your product on our formulary, so nobody's going to use it. And in common parlance, that's known as a kickback. But there's a piece of legislation called a safe harbor, which means that those kickbacks are legal. And the Trump administration tried to do away with those. Again, the PBM lobby killed it. But I think that pretty quickly the FTC is going to see through that and start asking some very tough questions.
Is there any hope, Peter, that this could actually give consumers better prices? I mean, prescription drug costs through the roof in this country. Nearly every president has vowed to try to bring down the prices of prescription drugs. But especially in an inflationary environment like we're seeing now, is there any ease for the consumer ahead?
I think that there is, because when most people say that my drugs are too expensive, what they generally mean is that my copay at the pharmacy is too expensive. And those rates are set almost exclusively by PBMs to fatten their own pockets. So I believe that if we can look at a safe harbor for rebates and redefine them as kickbacks, all of a sudden the game is going to change pretty fast.
Now, is there any sense that this is part of a wider effort, Peter, by the Biden administration specifically to try to lower these costs?
Well, I certainly hope so. The American consumer is getting run through the ringer by PBMs. It's pure greed. They bring no value to the system. They're purely the middleman. And rather than passing along their huge discounts to consumers, they're pocketing them, and they have the chutzpah to charge patients more at point of dispensation at the pharmacy. So I think the FTC is going to start looking at business practices, and I think they're unethical. I think that's exactly what the FTC is going to find.
I want to read through some of these stats. Peter, more than 3 in 4 adults in the U.S. think the cost of prescription drugs are unaffordable, and nearly 1 in 3 adults say they haven't taken their medications as prescribed due to high costs. What is the role that these PBMs play in that, and what needs to change?
Well, they pocket discounts that they receive from pharmaceutical companies. So if they were taken out of the equations, prices would drop about 15 to 20% at the point of dispensation at pharmacies right away. And that would be a tremendous relief. Imagine all of a sudden going into the pharmacy and your bill is 20% less because PBMs are being taken to task over their predatory practices.
My final question to you, Peter, is how do they impact some of these smaller, more independent pharmacies versus giants like a CVS, like a Walgreens, whatever it may be? Are these smaller independent ones at risk?
That's a great question. PBMs are putting small independent pharmacies out of business because PBMs, believe it or not, own pharmacies. They are part of large insurance conglomerates. They want the little guy to go away so they can have a complete monopoly, especially in smaller communities. And that's not good for healthcare. When you only have one pharmacy to go to in a small town, prices are only going to go up.
All right, Peter Pitts, we got to leave it there. Peter's the former FDA Associate Commissioner and President of the Center for Medicine in the Public Interest. Peter, thank you for taking the time.